Hi, Jerry.
So, Chairman, we're now live.
Thank you very much, Kirsty. Thank you, and welcome everybody to this meeting of Bracknell Forest's Local Outbreak Engagement Board. We have a number of apologies for this afternoon, so we'll take those as read and they'll appear in the paperwork in due course. And anybody who hasn't been able to connect for any reason will be taken to have apologized. So that said, we'll move straight on to item 2, which is declarations of interest. Do we have any declarations of interest to mention at this moment in time, please? No? Well, I would just issue the usual caveat that should any disclosable pecuniary or affected interest become obvious due to an unexpected twist or turn in the items that we're hearing about this afternoon, would anybody who is so affected please interrupt proceedings so that they can register that interest. That said, then we'll move on, and I will ask Kirsty, do we have any urgent items of business?
No, Chair, none that I'm aware of.
No. Okay, then that's fine.
Chair, apologies for my late arrival. It's Councillor Barnard here.
Hello, Councillor Barnard. Yes, lovely to have you. How's the field?
Wonderful.
Thank you.
I think it's many happy returns for Councillor Barnard.
Yes, it is. Yes,
it is indeed. Yes,
many happy returns. Yeah.
And I can confirm I received my first supported living spam email this morning, coupled with 2 more funeral plans. So I feel in good company today.
It's good. It's good to feel in touch, isn't it?
Well, having seen the photographs, who invited Jeremy Corbyn, Gareth?
Thank you.
Sorry, we're currently live.
Thank you. Right, moving on to agenda item 4. That's the public health COVID epidemiology and policy update, and Charlotte Pavitt's going to give us an update there. Thank you, Charlotte.
Thank you. I'm just sharing my screen now. Is everybody able to see the slides?
Yes, indeed, we can. Thank you.
Fantastic. Okay, so the update as of this week, as of today, we know that we're just shy of 10,000 confirmed cases throughout the entire pandemic in Bracknell Forest. And in the last 7 days, up until the 4th of August, so this is up in the data where we have complete data up until the 4th of August, we've had 295 new cases in Bracknell Forest. That means that our rate has thankfully reduced once again to 237.6 cases per 100,000, a slight decrease on the 7 days prior, and a 57% decrease on the week prior to that. So what we can take from that is that steep decline that we've been seeing over the last couple of weeks is beginning to level off, and you'll see that a little bit more clearly in the next couple of slides. Also looking at our vulnerable over 60 population, we know over the last couple of weeks we've had anywhere between 10 and 14 cases, weekly cases, which means that our rate is at 55 cases per 100,000, and that's sort of increasing and falling over each day as it comes, but it's remaining fairly steady at between 10 to 14, 15 cases in that vulnerable age group. Again, indicating that the vaccine is doing what it needs to do and protecting severe illness in those who are vulnerable to that. We've seen in terms of the first column in the table that our testing rate has reduced down to 483 tests per 100,000 population, and we know that just over 7% of those tests are positive. That stayed relatively stable over the last week and is round about in line with the Southeast average, and is pretty much middle of the pack in terms of our counterparts across Berkshire as well. So where we were over at the peak of the wave 3, when we were significantly higher than the other boroughs in Berkshire, now that's come down and we're back in line. This next slide just explains the RAG rating of the previous table. So I just wanted to show that. And just going back to the previous table, we know that this pattern is being seen nationally and regionally. There is some explanation for that decline, likely to be artificial due to individuals not testing. We know that the school testing programme is obviously not in place over the summer, and also individuals, there is evidence that individuals are reluctant to come forward for testing as a result of the relaxation of the restrictions and the move to step 4, and of Monday, those who are contacts who are fully vaccinated or under the age of 18 will no longer have to self-isolate as a contact. So all of these are at play and affecting testing behaviour. However, that said, there is uniformity across all regions and hospitalisations are flattening. So there is evidence to suggest that this is a true trend, downward trend in infections over and above less people coming forward for testing. I just wanted to flag that as well. And here we can see across Berkshire, which is the blue line, against the South East average in the orange and the England average in the grey, that sharp decline from wave 3 that's beginning to level off. You can see a slight levelling off in the most recent week. And when we look specifically at Bracknell Forest in the top left, we can see again that evidence of that sharp decline beginning to slow down and to level off, which is the same across all of the other boroughs as well. We know that and you'll see, we look at the age-related case rates, you can see that the rates in the school-age population significantly dropped off following the breakup of the schools, which was expected. And then that coupled with the relaxation of restrictions and the move to step 4, meaning that more of the general public is having more social contact, and therefore transmission risk is higher. The two have started to counteract and level off, and that's what we're seeing now in terms of that case rate leveling off. It'll be the next week or so that will really show us what that true trend is going to be looking like. So a bit of a case of watch this space. I just wanted to show this graph, whereas the previous week, this map rather than a graph, sorry, was completely dark blue with all areas, all local authorities having a case rate of over 250 cases per 100,000. We're now seeing uniform reduction. There's still a few hotspots to the east and the west with our neighbours in Spelthorne and Hillingdon, and also over in Wiltshire, but largely a reduction under the 250 cases per 100,000. And then when we look, this is the previous week's data, and we're awaiting publication of the forthcoming week's data. But when we drill down and look at what's going on in terms of the cases that we're experiencing, we know that in the 18 wards, 13 of them in Bracknell Forest had seen a significant decrease up until the 3rd of August, and the rest saying similar. We were watching Bulbrook ward because the rate was significantly higher and had been for a couple of weeks, having seen cases at over 1,000 per 100,000, but that reduced rapidly last week, back down to 235, and has remained in line with the borough average and the other wards across the borough. So again, it was a short-lived peak and it's gone back down. And you'll see in a map that I've got to show, there are a few hotspot areas where rates are higher, but no consistently high rate in any one area, so no geographical hotspots. We've had no new deaths, thankfully. The last death was reported in Bracknell Forest on the 2nd of July. And we'll come on to the age-specific heat maps, but they're all moving in the right direction. We can see, as we've seen before, that the vast majority of our cases are in the 18 to 34-year age group, and that's the same across all of our local authorities in Berkshire. We've started to have a little look at testing rates to see and explore that testing behaviour locally, and we have found that testing rates have reduced as expected significantly in the school age population and remaining fairly stable across the other age groups. This just comes on and drills down into the geographies a bit more. We can see there's, last week there were some hotspots, Great Hollands North and Little Sandhurst and Wellington. That's not been the case this week. And the map here looks different again for this week's geography and the case rates in each of the wards, and that will be published. I've got the link to the Berkshire Public Health dashboard where this week's forthcoming briefing note will be published, and you can see which wards are showing highest. But as we've seen throughout the entire pandemic, those wards, those cases peak and ebb across all of the different wards. When we look at our case rates per age group, we can see here, this is up till the end of July, that still our case rates are highest in the, well, through from 10 to 39-year-olds, really, 35, 39-year-olds. This week, we've really started to see a drop in our school age population, and actually it still remains the 18 to 30-year-olds where our case rates are highest. Again, this is the graph for deaths across Berkshire as a whole, but as I've mentioned, no new deaths, thankfully, in Bracknell Forest since the 2nd of July. Again, reinforcing that whilst we are seeing some hospitalisations, and that's the next slide coming up, the severity, the vaccine is protecting against the severity of the virus. We can see here that there has been a slight increase. This is for Frimley Health NHS Foundation Trust. The top graph looks at patients admitted to hospital, and the bottom one looking at patients in hospital with COVID-19. You can see a slight increase in both, but nowhere near the levels that we were seeing in hospital in wave 2. We do know, however, that there are pressures in both primary and secondary care with the backlog of patients and coupled with the slight increase in COVID admissions as well. So whilst the pressures aren't being caused solely by COVID admissions, they're still there within our NHS services, and we need to be mindful of that. We're still in the situation where the majority of people in hospitals are unvaccinated, particularly younger patients. We know that among the older adults, those who are hospitalised who are double and single vaccinated are mostly frail or have underlying health conditions that would have affected their immune response to the vaccine. And those who have been fully vaccinated do, on the whole, tend to experience milder disease for a shorter period of time. So I can't continue to stress enough the importance of being vaccinated to prevent severe disease from the virus. And a very similar picture for hospital activity for the Royal Berkshire NHS Foundation Trust also. And then when we look at our vaccinations, we know that the vaccinations are still going up. We've got just shy of 70,000 people fully vaccinated in Bracknell Forest now, and 87,000 who have received one dose of the vaccine. We know that there is a slight difference in our vaccine uptake between males and females in the 35 to 64-year-old age group. In the over 65s, there doesn't appear to be a difference between the genders, but there are fewer males taking up the vaccine in those younger age groups. So again, reiterating the importance. That gap is decreasing, and we hope that that will continue to do so. And you can see here across the age groups what the vaccine uptake is in Bracknell Forest compared with the South East average and the England average and our neighbouring areas across Berkshire. On the whole, when you look at it across the piece, Bracknell Forest, for both first and second doses of the vaccine, is higher than the national average, but there are certain age groups where we have got a little bit of work to increase the uptake, and encouraging all individuals to come forward for their second dose at 8 weeks after their first dose. As I've said, the updated data for this week that's just being ratified and confirmed will be published on the Berkshire Public Health dashboard, and this presentation will be there in its entirety with that updated information. And then finally, just to summarise some of the policy updates and the position around the COVID response locally, in terms of testing, the symptomatic PCR testing will continue and will continue locally at Bracknell Leisure Centre. So anybody experiencing symptoms or who have been advised to get a PCR test or having a PCR confirmatory test as a result of a positive lateral flow test can still access that test locally at Bracknell Leisure Centre or via post via gov.uk. And we will continue to deliver the asymptomatic regular lateral flow testing. Individuals still encouraged to test regularly can do so via the gov.uk postal service, or locally can collect home test kits from any of the pharmacies in Bracknell Forest or any of our local mobile testing sites and the test site at One Lexicon. And then if individuals are if they do experience symptoms or get a positive lateral flow and a confirmatory PCR positive test, it's still vital that they self-isolate. That's still important to break the chain of transmission. Now, what's changing is from Monday, the 16th of August, those who are identified as contact, if they're fully vaccinated or aged under the age of 18, they no longer have to self-isolate. Self-isolation, as I've said, still required for cases. What's, as everybody is aware, there's been a significant impact on critical services, and therefore there are exemptions in place when approved by the Director of Public Health or directly through the appropriate government office for critical workers, and all of those businesses or services are aware of those processes and how to request that exemption if service delivery is impacted significantly and poses a greater risk than self-isolation of contacts. In addition, the daily contact testing has been evaluated in a number of businesses and also within schools, and has been found to be a safe alternative for self-isolation. And therefore, we're in the process of rolling out, I say we, the national government are in the process of rolling out daily contact testing for critical businesses, and also exploring that as a longer term option for those that aren't fully vaccinated, because if you aren't fully vaccinated, it's still a requirement to self-isolate as a contact of a case after the 16th of August. There's also been some travel updates, constant travel updates in terms of which countries are classed as green, amber or red. But in terms of the travel to amber countries, those who are fully vaccinated and children are no longer required to self-isolate on their return, but they are required to test. All the information is in the link that I've embedded there. And then in terms of the vaccination programme, it's been recommended by the JCVI and is now being offered to 16 and 17-year-olds. And for all updates, I've noted the Frimley Health and Care website, where all the information will be in the coming days, and the vaccination of care home staff and also wider staff. So any staff that are going into care home, it is now mandatory that those staff are vaccinated. So again, we're working with our providers and also our directly employed staff who are going into care home staff to ensure that that is the case. And as has recently been announced, also the booster programme has been advised by the JCVI for those who are vulnerable to the harmful effects of COVID vaccine, to the COVID virus, and the NHS are currently working through what that booster programme will look like. And then finally, we are getting more detail come through from the update that I gave at the last local outbreak engagement board and the move to phase 4 and what that means on the ground. And we're currently working with our schools to help them develop their own local outbreak management plans. And I will pause there.
Thank you very much indeed, Charlotte. Colleagues, do we have any questions from anybody to Charlotte on that excellent presentation? No? Okay. Oh yes, Councillor Dr. Barnard, your hand's up.
Thank you, and thank you as ever, Charlotte, for a very, very full presentation. I guess my question is, the changes in guidance around testing and the need to self-isolate, you know, if you've been in contact and you're pinged, if you've had the double vaccination from next Monday, what are we going to try and do to try and encourage people to continue where appropriate testing? Because we still need to know how this is moving through our community, particularly as we're moving in the month run up to the return to school. And as we know, of course, it was the schools and the community transmission which boosted things, because I'm personally struggling to understand how we can ensure that testing continues to try and help us tackle this. I think would be my question with the changing guidance. Does that make sense?
Yeah, so in terms of the changing guidance, that's for those who identified as contacts of a case. So, yeah. But it's still important, and the national message remains the same. It's still important that we know where the cases are. So yeah, it's in the vaccination programme and the testing programme are the two key important things as to how we navigate and manage transmission moving forward. So we will continue with the, and we've got the communication update with the communication strategy that will continue to clarify, identify, explain the testing programs and the options and what people should be doing. And in addition, we are looking at the testing strategy as well locally, and ensuring that we have provision for the community collect for testing in areas where testing need is greatest. So for population groups that are disproportionately impacted by COVID, as well as areas where we know uptake is lower. So so that's something we're working to and looking at exploring mobile testing provision, roaming testing provision, and working with our voluntary community and faith sector to identify venues within local communities to pop up and have a regular session for the local community to come and access tests there too.
That's helpful, thank you. I think Kelly wanted to come in there as well, I think, Chair.
Thank you, Kelly.
Yes, thank you, Chair. Yeah, just to add to what Charlotte was saying, Councillor Barnard, and particularly with regards to the school situation. So in terms of testing in schools, there is still a requirement that everybody will continue to test twice weekly throughout September within our school communities. So that's all students and staff within secondary schools and staff only within primary schools. Throughout September, all of that twice weekly home testing will be done at home. But in terms of the autumn term beginning and secondary school children returning to school, there is an expectation, and I know all of our secondary schools and colleges have got plans well underway, that they stand up full on-site asymptomatic testing provision within the schools. And all students returning to school must have 2 on-site supervised LFD tests 3 to 5 days apart before returning into the school community. We know that that's going to be in place until the end of September, and then the government are proposing to review the situation at the end of September, and at that point we'll understand what the longer term testing provision looks like for our schools.
That's helpful. Thank you, Kelly.
Thank you, Kelly. Thank you, Gareth. Thank you. Councillor Peter Hayden, your hand was up. Is it has it been covered, or do you still have a question?
No, I don't know whether Charlotte can answer this, but certainly in the ward, there are a number of people who believe themselves to be healthy to the point of being invincible from COVID. Can I confirm to them that even if they feel they're healthy, everybody is still at risk, and the vaccination actually A, reduces the chances of even healthy people getting it, and B, if they do get it, it reduces how severely affected they are.
Yes, absolutely.
Yeah,
Everybody.
Yeah, thank you, Sean.
Everybody over the age of 16 now should be seeking the vaccination, unless there's a clinical reason why that they shouldn't get that, and that's a discussion for them to have with their GP. But it most certainly does protect all from severe illness. Yes, so absolutely.
Because I keep on getting these so-called invincible mails saying it's never going to apply to me, and I just wanted to make as strong an answer to them as possible.
Yeah, and there's lots of information and FAQs and myth busting on our NHS colleagues website. So again, we can pop that I'll put it in the chat to go into the minutes, and we can signpost individuals there too.
Thanks very much indeed. Thank you, Charlotte. Any further questions? If there are no further questions, then Councillor Dr. Barnard, your hands, is that a legacy hand? Still up, an old hand? I'll take it that it is. And we'll move on then to agenda item 5, which is communications and engagement update at both a national and local level. And that's going to be introduced today by Kelly Williams. Thanks, Kelly.
Yes, thank you. I'll just share my screen with you. Okay. Can you see that yet?
Not yet. Yep, we've got it.
Perfect. Okay, so thank you. I'm going to just be talking us through the latest communications update today on behalf of my colleagues from the communications and marketing team. So the first section I'm going to talk you through today is with regards to testing and the focus of our communications with regards to our testing programme at the moment. So the first key message really that we're continuing to push out across a number of our channels is the importance of regular LFD testing and the importance of self-isolation that you've just heard Charlotte talking about. So the regular twice weekly LFD testing that people can collect from pharmacies or one of the testing centres, as we've already heard, and also the importance of self-isolation. So self-isolation for everybody who is either a positive case or a contact up until the 16th of August. And then beyond that, the importance of self-isolation for those people who test positive for COVID. One of the bits of feedback that we were receiving from some of our testing centres is that members of the public appeared to be unclear on what was the correct type of test to use in what particular situation. And one of the issues that this was causing was that we were having a number of individuals who were symptomatic with COVID symptoms who were presenting at our lateral flow rapid testing sites, which is not an appropriate way for them to test. Those individuals need to book a PCR test via the online system or by calling 119. So we've produced a postcard which we've distributed at both our test centres, but also in other sort of public-facing locations across the local authority area, that just does some explanation as to what type of test you should use and in what situation. And that postcard has got QR code links on it, both to the vaccination information and the testing details. So people can scan that and be taken directly to the correct site in terms of booking or arranging the relevant testing appointment. Outside of the particular postcard that we've developed, we've also been pushing comms messages out around what type of test people should be having, whether they're symptomatic or asymptomatic, both on social media and in hard copy on the Bracknell News in the form of an advert. We've also been focusing our comms on some of the key issues around travel, particularly international travel. Pushing those particularly on social media for those residents who are considering holidaying abroad, so to help signpost them to the appropriate testing providers and requirements for that international travel, with those requirements all being met through private provision. So anybody who needs testing for purposes of travel should not be attending our LFD rapid testing sites, nor the PCR testing sites that are for symptomatic people. And the final piece of news that we've been pushing around the testing information is to do with the fact that we're once again going into a cycle of having regular mobile testing units back on site in the borough from last month, and that will continue over the coming months. So again, pushing that through both social media promotion and also various e-newsletters to reach as broad a relevant audience as we can. If we move on to vaccinations, so working closely with our colleagues across the health service to ensure that we're getting accurate and consistent information out to our residents around the vaccination programme. So we've heard today some of the areas where we're seeing slightly lower uptake than we would hope amongst our population in terms of the vaccination programme. Albeit overall the programme is performing incredibly well locally and has been a huge concerted effort by our colleagues in the health service. So continuing to promote the message that any remaining over 18s should be encouraged to come forward for their first vaccination dose, and also the fact that they can bring forward their second dose to 8 weeks rather than the 12 weeks that it was originally. So all of that is in line with the national messaging and policy changes that are coming out from central government. More recently, we've been pushing some new messaging out, particularly targeting those people who are under 18 and who are now eligible for their first jab. So that could either be because they're 16 or 17 years of age, as we've seen nationally in the very recent news. Those individuals are now eligible for vaccination. But also 12 to 15-year-olds who either themselves are clinically extremely vulnerable or who live with somebody who is clinically extremely vulnerable. Those individuals as well are also eligible for vaccination. So again, just providing messaging around that. The pop-up vaccination unit that was run by our colleagues in the health service was extended from the 13th to the 18th of July. And we worked very closely with colleagues in the CCG and Berkshire Primary Care Trust to ensure that local residents were aware of that pop-up vaccination provision. And also we've got more comms that are planned, again, working jointly with colleagues in the CCG, including some video testimonials from those people who have now been vaccinated. Also done some work specifically trying to engage with younger people using imagery and channels that are more suited to them, such as Snapchat and Instagram. But again, very mindful not to exclude older cohorts, as we know from the data that there are still older people within the population locally who need to come forward for their vaccination. So we've had some really successful Snapchat channels reaching 250 click-throughs across 2 highly targeted adverts that we placed. Continuing to use a number of variety of other channels, so across media, paid for advertisements, physical on-site signage, social media. We've had an ad bike roaming the borough, as well as using some local influencers, Max and Harvey. So they've got an Instagram following of just over 950,000 followers, and also a local campaigner from Berkshire Against Racism, Karima. So using some video ads again to just try and target some different cohorts of our local population to get that message out. In terms of further work that's being done around communication, some of you may have seen on social media a jab-in video, which was created by our colleagues at Frimley CCG, featuring some dancers from local performing arts college, Artemis Studios, based in Bracknell. Again, been promoted on social media, and the dancers that took part in that video have also been interviewed on BBC Berkshire. Again, the focus of that to try and promote vaccinations to the younger cohort. Again, continuing to focus on the vaccination pop-up provision over the coming days and promoting the Grab a Jab campaign, which continues to run at our Waitrose Sports and Leisure Centre until the 15th of August. So continually working with our colleagues in the CCG to get the latest information on when those pop-up sites are available to the local community. We've seen nationally some concern around vaccine take-up in pregnant residents. So again, we've been doing some local messaging on social media, particularly supporting information around vaccine take-up for pregnant individuals. And again, some short videos released on, again, social media around the safety of the vaccines, following individuals who may have expressed some concern around the safety of vaccines. And as Charlotte mentioned earlier, we'll be able to signpost to the information that is held on our colleagues in the Health Service website, which has got lots of really useful information that will help to reassure people around the safety of the vaccine. We've got a new focus more recently on vaccinating men, particularly men within the age 25 to 34-year-old cohort, which we know are underrepresented locally, as well as nationally in terms of people coming forward for their vaccine. And as part of that, we've been engaging in some initial discussions with some local pubs and also Binfield Football Club to see if we can do some work in partnership with them to do some targeted comms to those particular cohorts of people. And then the final point on vaccinations is just the release of our Don't Do Half a Job video, which emphasises the need for all individuals to be fully vaccinated. So for anyone using AstraZeneca, Moderna or the Pfizer vaccine, obviously that involves 2 doses. So the final points to cover today are just where we are in terms of the roadmap and the comms that we're working on with regards to the roadmap. So all of these comms continue to be in line with national policy. So within our own office buildings, we have, as a local authority, began to see more staff returning to our own office space, along with other local businesses in the area, and really focusing on a slow, gentle and gradual return as encouraged by central government. Also continuing to support our partners, such as colleagues at the Lexicon, with messaging around social distancing and face coverings where they may continue to be appropriate. And also really pushing the message that we've moved into stage 4, that it's not the end of COVID, and that whilst the legal restrictions may have ended, actually it's simply a shift of focus away from legal restrictions to encouraging people to follow safe practice. Linked to that, we have initiated an ongoing Be Courteous campaign, which is really about encouraging people to be COVID courteous rather than following the law. So just around enforcing the messaging around the government's key pillars for keeping safe from COVID-19. This will include things like the wearing of masks or face coverings, particularly in indoor crowded environments. From next Monday, we know that the self-isolation rules are changing, as you heard from Charlotte earlier. From the 16th of August, close contacts who are under the age of 18 or fully vaccinated will no longer be required to self-isolate. So we've got a number of comms channels that we're going to be using next week to push that message out, including an advert in the Bracknell News next week. And then finally, we've held a focus group with our Youth Health Council, looking to work in partnership with them on messaging and engagement, particularly with young people. So I'll stop sharing that screen now and happy to take any questions if anyone has any.
Thanks very much indeed, Kelly. Thank you. Colleagues, do we have any questions for Kelly? Councillor Mrs. Hayes.
Sounds as if, first of all, that Councillor Barnard's still in the field. I can hear children or something in the background, laughter. Having said that,
I have long since stopped making that noise, Dol.
I thought it was your birthday party you hadn't invited us to, sir. Having said that, Kelly, that paperwork is excellent. One thing I'm always thinking ahead. And one of the things that, even though we're doing the planning now, we are looking at the ways we're going to advertise the September, or like the winter flu jab. You know how they put that one out? That I wouldn't want to see you under pressure with all this going on and then having all that as well. You have kept that in the forefront as well.
Yeah, very much so. I know that we've got both Charlotte and I believe Fiona on the call today. So I don't know if you want to provide any more detail on that, but can absolutely reassure you, Councillor Hayes, that that's very much part of the communications plan.
I wouldn't expect any better from any of you, but it was just, it's that thing in the mind that you always prepare, you're prepared.
Yeah, absolutely.
It's on the shelf, pull it down, and here we go with it. Yes. Yeah. Thank you.
Thank you. Colleagues, if there are no more questions for Kelly, then we'll thank Kelly very much indeed for delivering both those reports, and we'll move on to agenda item 6, which is headed public participation, and that's to receive questions and provide answers to those questions from members of the public. Kirsty, do we have any member of the public questions today?
I'm not aware of any questions being submitted to the committee drop box.
Okay.
No.
Fine. All right then, which takes us to agenda item 7, which is to review the action log by exception. Is there anything that anybody has to report to us of an exceptional nature from the action log? No. Okay, that's fine. I should remind you that our next formal meeting is planned for the 7th of September. But of course, if there should be any unexpected reasons, then we will get in touch with everybody and call a meeting in the interim. And just before I close today's meeting, I'd like to formally welcome Gronya Siggins, our Director of People, to her first meeting, I believe, of this board, and also to Gabby Hafner, who's joined Kelly's team. Welcome to you both. Lovely to have you with us, and we're grateful to you for your presence today, both of you. Thank you. And also to, on a rather sadder note, on behalf of us all, to wish Charlotte every success for the future. Charlotte, you've been a tremendous help to us all. You're the one that has all the answers, and we shall miss you. But our loss is Devon's gain, and thank you very much indeed for all that you've done for us and the people of Bracknell Forest.
Thank you, Councillor Beston. It's been a pleasure.
Thank you. Thank you. Well, colleagues, thanks very much indeed for your attendance today. And at this point, I'll ask Kirsty if she can please cease the live.